Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. When is fever after surgery a concern? A fever after surgery, postoperative fever, is a common complication. There are a range of reasons why you might get a fever after surgery, including problems like infections that need treatment. You might be more likely to have a post-op fever after a major surgery or procedure because your body is under a lot of stress and there is more tissue trauma and inflammation. Both children and adults can get fevers after surgery. /r/n/r/n Most postoperative fevers are not serious and can be treated at home with Tylenol, acetaminophen. Some low-grade fevers do not need treatment at all and will get better on their own. However, a fever after surgery can also be a sign of a more serious complication like an infection. That's why any fever after surgery needs to be taken seriously and watched closely. /r/n/r/n This article explains some of the reasons you could have a fever after surgery. It also discusses how to treat a postoperative fever and when to call your provider if you have a fever after surgery. /r/n/r/n Illustration by Julie Bang for Verywell Health /r/n/r/n Surgery-related fevers can have different causes. /r/n/r/n Two post-surgery complications that can cause fever include atelectasis and pneumonia. /r/n/r/n A partial or completely collapsed lung, atelectasis, is one of the most common causes of fever after surgery. Anesthesia causes the little air sacs, alveoli, within your lungs to deflate, leading to areas of the lung collapsing. /r/n/r/n Pneumoniais is a lung infection that inflames the air sacs and may fill them with fluid or pus. The infection can come from bacteria, viruses, and fungi, or can be caused by inhaling, aspirating, food or liquid. Sometimes, this can happen while a person is having surgery or right after when they are recovering. /r/n/r/n A urinary tract infection, UTI, can cause a fever post-surgery. If you had a urinary catheter during your surgery, you have a higher chance of getting a UTI. /r/n/r/n There are also other infections that could cause a fever after surgery. /r/n/r/n A low-grade fever is sometimes seen in patients with blood clots after surgery. However, they will also usually have other symptoms of a blood clot like pain and shortness of breath. /r/n/r/n Types of blood clots that can happen after surgery include /r/n/r/n Post-surgery fevers can be caused by blood transfusions or medications that were given during surgery. Fevers caused by a medication reaction may get better on their own. When they do not go away or get worse, fevers can be a sign of a more serious reaction. /r/n/r/n Sometimes, the surgery itself is not the cause of a postoperative fever. You could have caught the flu a few days after surgery, or you might have an infection that isn't related to the procedure. /r/n/r/n The more time that passes between the day of your surgery and the day of your fever, the less likely it is that the fever is related to your surgery. This is especially true if you are weeks into your recovery when you get a fever. /r/n/r/n Common non-surgical causes of fever include /r/n/r/n You may have different types of fevers after surgery, based on how high your temperature is. You also might start out with one type of fever that progresses to a more serious type. /r/n/r/n The timeline and severity of a fever provide extensive information about its source. Mild postoperative inflammation is expected and may cause a low-grade fever. More emergent causes, such as DVT, pulmonary embolus, and infection warrant immediate investigation and treatment. It's advisable to speak with your surgeon about any fever in order to rule out and prevent or treat serious complications. /r/n/r/n A fever is considered low-grade if your temperature is 1 or 2 degrees above the normal reading of 98.6 degrees Fahrenheit. While it might not be a serious fever, it's still best to let your healthcare provider know if you have a low-grade fever after surgery. /r/n/r/n A fever of 99F is very common, especially in the first week while your incision is healing. If you have a fever and your incision is not healing well, tell your provider right away. You may need medical attention. /r/n/r/n You should also let your healthcare provider know if you have a low-grade fever that does not go away after a few days. /r/n/r/n A fever between 100.6 and 102 is considered moderate. If you have a moderate fever after surgery along with the following symptoms, your provider might want to see you as soon as possible or send you to urgent care or the ER/R/N/R/N. These symptoms can be a sign that a post-surgery problem is developing. /R/N/R/N You should also get medical care if your fever does not come down within an hour of taking a dose of a fever reducer such as Tylenol. /R/N/R/N A fever higher than 102 in adults needs immediate medical attention. A fever this high could mean you have a serious infection, there is a problem with your surgical site, or you are having a serious reaction to a medication. /R/N/R/N Tell your provider if you have a high fever, then go to urgent care or the ER/R/N/R/N A low-grade fever may not need treatment other than over-the-counter, OTC, medications such as Tylenol. These medications are usually effective for treating a fever. /R/N/R/N If you are taking pain medication that contains Tylenol or Advil, ibuprofen, after surgery, know that you could have a fever and not realize it. These medications typically lower fever and treat pain at the same time. /R/N/R/N Bringing down a fever with medication may not be enough. You may have an infection that requires prescription antibiotics or need wound care. /R/N/R/N An antibiotic will not always be able to treat a fever. For example, antibiotics do not treat an infection caused by a virus or fungus. It's also possible that an infection is not the cause of a post-surgery spike in temperature. /R/N/R/N If you have a high fever, your provider may do blood, urine, and wound cultures. These tests can help determine which bacteria or other organisms are causing infection and make the best choice for treatment. /R/N/R/N Your provider might want you to start treatment before your test results come back. Alternatively, they also may have you wait until the test shows what the cause of the infection is before making a decision about treatment. /R/N/R/N In some cases, your surgeon might want you to start taking antibiotics before surgery or right after, even if you do not have any signs of an infection, as a preventive measure. /R/N/R/N There are some steps you can take after surgery to prevent an infection. /R/N/R/N Call your provider if you have a fever after surgery, even if it's not very high. While they might tell you that it's nothing to worry about, they will probably want you to keep an eye on it and let them know if it's not getting better. They'll also want to know if you start having any other symptoms, like a pus-filled discharge from your incisions or increased swelling, that could point to a post-op problem like an infection. /R/N/R/N It is very common to have a mild fever after surgery. If you have a fever between 99F and 101F, it may go away on its own or with OTC medication. However, you should still tell your provider you have a fever and check it to make sure it's not getting worse. /R/N/R/N A fever can be a sign that you're developing an infection somewhere in your body. If your fever is high or not getting better, your provider might need to do tests to figure out the cause and recommend treatment. /R/N/R/N Having a fever over 102F needs medical attention. You should also go to urgent care or the ER if you have nausea, vomiting, shortness of breath, disorientation, or any signs of wound infection after surgery. /R/N/R/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.